You may know Anna Nicole Smith as the lady who married this 89-year-old rich businessman. Or you may know her as the actress, model, and Playboy bunny. Regardless of how you knew about Anna Nicole Smith, today we're going to talk about how she died and go through her autopsy. And if you want to check out all the other celebrity autopsies I've already covered, there's a playlist at the top of my profile. So let's get right into it. Anna Nicole Smith was born November 28th, 1967 in Houston, Texas, and she passed February 8th, 2007 in Hollywood, Florida at the age of 39. Her official cause of death was acute combined drug intoxication. So let's go over the list of drugs that were in her system that were combined, causing her death. First, we have TCE, which is an odorless clear chemical. She had 75 micrograms in her system, as well as 85 micrograms of TCAs, which are antidepressants for severe depression. Then they found Benadryl, Valium, clonazepam, tenazepam, lorazepam, all these PAMs that I've already talked about before. There were other medications and drugs in her system that did not contribute to her death. Those drugs included like Tylenol and muscle relaxers, etc. They found fibrosis with fat necrosis, aka chronic repeated injections of various medications in the buttocks, of dermal and subcutaneous tissues, bilateral gluteal regions, and anterior right thigh. So she was getting medication injected into her butt, basically. And depression following the recent delivery of term infant and recent death of adult son. For those who are unaware, this was Anna Nicole Smith's son, Daniel Wayne Smith. He passed at 20 years old, a year before she passed, also of a drug overdose. Because she had just given birth and just lost her firstborn, she was on crazy antidepressants. Not only was she experiencing postpartum depression, but the loss of a son as well. She suffered a chronic thyroid condition, also known as Hashimoto, and she had a well-healed pubic scar post-C-section. Minimal insignificant fibrosis, post-bilateral breast implants with scarring, minor infraction of brain, and minor contusions posterior shoulders. Anna Nicole Smith, whose real name was Vicki Lynn Marshall, was a 39-year-old white female who died of acute combined drug intoxication. Abscess of buttocks and viral enteritis were contributory causes of death. Enteritis just means inflammation of the small intestine. You can pause and read yourself, but since I am running out of time, I'm going to skip down to the tattoo. She had a pair of red lips on the right lower abdomen quadrant, 2 red cherries on the right mid-pelvis, a Playboy bunny on the left anterior mid-pelvis. The words Daniel and Papa's are on the mid-anterior pelvis region. I'm so sorry, but I ran out of time.